Thank you, thank you. Hi, everybody. Welcome to today's conference. Uh, this is our first conference since the new year, so Happy New Year to everyone, and hope you're having a great day. We're exceptionally warm here in Chicago today, although it's raining, but it is quite warm. Uh, I hope you're having good weather also. Today we're going to talk about a different topic. And the reason why we wanted to talk about this related to orthopedics is there's been a lot of things that have happened over the last few years related to billing for care coordination and chronic care management and telemedicine is another thing that we're going to be not talking about today, but we'll probably have a future conference on it. But there's a lot of new codes that have come out in the past several years, and we get a lot of questions from orthopedic practices and physicians asking how they can or if they can use these codes and how can they use the codes. And then we also always have questions related to consolidated billing rules and when our patients are in the nursing home or rehabilitation center. So today we want to go through some of these and talk specifically about how they relate to orthopedics and if in fact when we can use these codes, how can we use these codes, and you know, the first thing I want to say in all of this is that these codes fall under the evaluation and management services. So the thing that we have to remember with these codes is they're not going to be covered during the postoperative period if in fact the conditions we are trying to report are related to that surgery. And that also includes complications of that surgery. So I think that's where a lot of physicians get the idea that they may be able to report these, but then we soon realize that they will not work within the postoperative period because they are considered evaluation and management included. But I want to go through today and talk about when these codes may be possible and how we can use them again. So looking at our agenda for today, we can see that we're going to talk about, first of all, the coordination care codes. And there are several categories of coordination care. We have chronic care management, and then we also have transitional care management, care plan oversight, and then the home health certification and recertification. Then we want to talk about consolidated billing rules and the two areas in which it affects orthopedic practices, which are the radiology codes and DME. And so we will spend the last portion of the session on that. So looking first at what does CPT define as the surgical package. Now, remembering that CMS or Medicare has their own definition, I don't know of an insurance company other than here, at least here in Illinois, the Medicaid public aid system does have their own post-operative days. But as far as commercial insurances, I don't know of anyone who isn't following the CMS definition of minor or major procedures. However, when you look at the CPT definition of post-operative period, it just says there at the bottom, the typical post-operative follow-up care. And so they don't give you any specific number of days or what that could mean. So the thing we have to remember then is if we're always doing something for every patient that has a particular surgical procedure performed, then that's going to be considered our typical post-operative follow-up care. And so and you might even want to define that in your compliance plan. I'm telling more and more practices to make these kinds of policies in their compliance program. So if in fact they're audited, they have a description of what their plan is, how are they interpreting things, and how they're using it in their practice. And that will help you with insurance companies questioning what you're doing. So the first thing is we're going to talk about then are the chronic care management codes. Now the reason why this can be somewhat difficult for a orthopedic surgeon is that you have to have a patient who you are treating for 2 or more chronic or continuous health conditions that will last at least 12 months and that place the patient at significant risk of death, exacerbation